Actually, I just want to highlight regarding the performance of civil hospital at present till yesterday, and we are glad to see, and then we are happy also to see that we are doing our effort to make our patients comfortable and make them homely in this place. And at the same time, we are giving the maximum care, whatever we can. So as a story, I just want to make a story in this. It's just like a game of cricket, I feel. Since inception, since the start of COVID-19, there was a slow pace of patient coming to civil hospital. So this I'm taking is as a cricket. We are a batsman, and there are bowlers behind. As a batsman, my team, Dr.S.S, staff nurse, grade 4, they are doing well. And I was glad to say that yesterday we have hit century in this game, COVID-19 cricket game in civil hospital. We have hit century. That means we have already totally all patient active case. We have 100 till yesterday. And out of these 100 cases, we are glad to inform that only 1 wicket has been done. So I think my team is the best team in the state. What I feel, I'm proud of them. Since out of this game, we are batting, half century. Then slowly, now the pace is very fast. Like a batsman, Tendulkar or Rohit. They start at a slow pace. And then when they start hitting half century, and the pace is increased. That's the same thing, the pace here. When we start this COVID-19 patient was only 3, 4, 9. Now we have got a total of patients, active patients, 100 already treated in civil hospital. And we have got, till today, inside COVID-19 isolation ward, we have got 21 patients. And we have got 5 in observation. So out of this 100 active case, there's only 1 death. That means, I just want to say that we have only 1 wicket down. So we are trying to reach double century also. And we are maintaining our pace to keep this wicket in hands. That means to keep these patients in our, to make them safe. We will not allow any patients to be bought again. So this is a story regarding civil hospital. I'm very thankful out of the state performance. Till today, I think 7 death was there. And 8 death was there. And out of that, 1 only in civil. So it's only, we have only 1 wicket now. I'm very proud of my team. I'm very proud of Dr. Andreas, Dr. Sarkar, Dr. Sunram. All of them, I cannot name them one by one. But, and especially the nursing staff and the grade 4. They are my backbone. Without them, we cannot perform anything in our setup. And I'm just only a leader. I'm just trying to make things right in place, make them strict. I'm very strict in the work. And I'm very glad that all of them cooperate with me. So this is a story of civil hospital hitting 100th century. Number 2 is that I just want, with this piece, the public should know that civil hospital is no more like before, where people thought that doctors in civil hospital, they cannot treat, they want to go to some specialized private hospital. But I'm very sure, with this kind of treatment, with this kind of enthusiasm they have, they can treat COVID and non-COVID at the same time. We have got now around 200 patients indoor, non-COVID case. And we are trying our level best to make non-COVID death to decrease, especially cancer patients. We have seen in the state the cancer rate is very high. It's almost like 3%. But COVID death is only, out of this 100 we have got 1. That means we have only 1% in civil hospital. So these things I would like the public to know and to be aware that please come to civil hospital. Don't be afraid. Don't stigmatize us. If you are afraid to come, means you stigmatize us. Why should you go to private hospital? They are also the same. They are also the people. They are doctors. They also are exposed. We are also exposed. But we are taking maximum precautions not to spread the disease to our patients. You will come to civil hospital, you will see inside how our staff maintain that social distance, hand hygiene, and wearing mask and face shield. I'm very strict with that, and my doctors who supervise all the work, they are very strict with that. We are functioning our OT 100%. We are functioning our dialysis unit 100%. And we are taking maximum care of cancer patients. I'm glad to inform also, I have got one doctor who has joined today, oncologist. And in that team, oncology department, we have got 4 doctors. So which shows that the state really has taken care of civil hospital. And I hope in future some more specialists will join here so that the department, different department can be strengthened. So I just request all the people in the state to come to civil and get the treatment, whatever we can. Whatever we have, the equipment, whatever testing we have, we will do it free for all. We are taking a minimum charge of testing. That is called user charge. So, and number 2 is that I want all the people on outside not to stigmatize our staff when they go to their place. Some of my staff, they say that they are not allowed to stay in their rented house. They will chase out. But these things now, it has come down. People are start accepting this disease as a community spread. So coming for testing and all in civil hospital, we are testing only high risk case. We are not going to test any returnees. We are not going to test any forces because this has been segregated by the government. Returnees will be tested in Polo, and forces, all paramilitary and all forces will be tested in military hospital. So we are doing a high-risk test in civil hospital. Why we are doing high-risk test means any patient who has exposed and are symptomatic, immediately we can put them in our care. And those who are asymptomatic, if they are positive while testing, by doing RAT, rapid antigen test, they will be immediately shifted to corona care center. So that's the way how we plan with the government to make things okay. So I just want to request people not to be panic. This disease is just like an influenza and flu. It's going to be like that only. This contact tracing and all, it's a burden to the government, what I feel. It's a burden to the government. And people like in the village and the community, they can even do this by just contain them in the particular place or in their own house. Not to allow them to move here and there. That is the main aim of this disease. We cannot treat the disease. This spread is there unless the community participates with the government. Contact tracing is that when you get positive, it doesn't mean that you are sick. What I feel is that now any people who have symptoms, they should come forward and get tested. So that will reduce the load of the health department, that will reduce the load of the government functioning, and that will really boost the economy of the government, of the state also. If people start coming forward and anyone who is symptomatic, they can come and then get themselves tested. And they will be admitted. Now Robert Hospital can admit patient, Nazareth can admit positive patient, civil hospital is admitting, military hospital is admitting, TB hospital we are keeping positive cases. So it's just that people should come forward and get themselves tested if they are symptomatic. If they are asymptomatic, there is no need to be panic. Because this disease, as it is now, it has been 6 months now. We have seen the scenario of this disease. It's not so serious that only because of corona or COVID-19 virus, people will die. Those who are dead, they die because of comorbidity. The one who died here in civil also, his son was here also. He was very, very thankful to our staff because we are taking care much now. Because he's a diabetic, he's a cardiac patient. And he died because of hypoxia, ARDS, that is acute respiratory distress syndrome. This COVID-19 is just, we have detected it, but the reality of the cause of death is not because of COVID-19. It is because of the pre-morbid conditions, comorbid conditions. So, I would like people, once and all, to come forward and work together with the government. Do not just question or argue It won't work. It won't work. Arguments and stigmatization, it won't work. One day you will be also, you might be positive. One day I might be positive also. We don't know. This community spread is very fast now. So it depends on the community how to come forward. Once you are symptomatic, we have signs of fever, cough, difficulty in breathing. You come forward, we'll test. And once you are positive, we'll take care about it. We want these positive cases to be tested as fast as possible so that there won't be any complications later on. We can treat coronavirus well as long as we can treat other conditions. We have to first think 70% of the treatment is for comorbid and 30% we are trying to reduce the chance of infection. That's all. So I again request to the public and to the government also that they should work together and play a major role from the public side to help contain this COVID-19 virus. Thank you.